A young man slipped on the wet floor and fell, injuring his arm. Radiographic images showed fracture of the humerus at the junction of the proximal end and the shaft. Which pair of structures was most likely injured at the fracture site? If you look at the first option, you will notice that the ulnar nerve and superior ulnar collateral artery are related to each other at the distal end of the humerus behind the medial epicondyle. The artery is a branch of the brachial artery and participates in the anastomosis around the elbow. Injury of the ulnar nerve may thus complicate a fracture of the medial epicondyle at the distal end of the humerus rather than the proximal end as indicated in the scenario. The ulnar nerve is trapped between the bone, which is the prominent medial epicondyle, and the overlying skin. At this location, the ulnar nerve can cause an electric shock-like sensation by striking the medial epicondyle of the humerus from posteriorly. This peculiar sensation experienced when it is struck is commonly referred to as bumping one's funny bone. This is also thought to be a pun based on the sound resemblance between the name of the humerus and the word humerus, meaning funny. Now let's look at the second option. The distal end of the humerus is related anteriorly to the median nerve. At this location, the nerve is medial to the brachial artery and both are medial to the tendon of biceps. It is here where the pulsations of the brachial artery can be felt. The median nerve and the neurovascular bundle may be injured at the front of the lower part of the humerus by a supracondylar fracture of the humerus, which is far away from the site of fracture mentioned in the scenario. The third option, injury of the musculocutaneous nerve. This nerve is rarely injured because the nerve is protected by muscles and doesn't come to lie near bones. In the axilla, the nerve passes through coracobrachialis and then traverses the flexor compartment of the arm between biceps and brachialis. The nerve may be accompanied by unnamed muscular branches from the brachial artery for both biceps and brachialis, but because the neurovascular bundle is sandwiched between the muscles, they are protected and less likely to be injured. Looking back at the scenario, the site of fracture of the humerus is at the junction of the proximal end and the shaft. This is the site of the surgical neck. The surgical neck of the humerus should be differentiated from the anatomical neck. The anatomical neck is the groove circumscribing the head and separating it from the medial and lateral tubercles. The anatomical neck indicates the line of attachment of the capsule of the shoulder joint. The surgical neck is the narrow part that is located at the junction of the expanded upper end and the shaft. It is a common site of fracture, hence the name surgical neck. The axillary nerve winds around behind the surgical neck, accompanied by the posterior circumflexohumeral artery, which is a branch of the axillary artery. The axillary nerve and associated vessels might be injured at the surgical neck by a fracture or even by a dislocation of the shoulder joint, inferior dislocation. Regarding the last option, the radial nerve leaves the posterior cord of the brachial plexus, passing through the posterior wall of the axilla to the extensor compartment of the forearm, where it lies in close relation to the spiral groove. The spiral groove is also called the radial groove because it lodges the radial nerve. At this location, the radial nerve is in close proximity to the profunda brachii artery, the deep brachial artery, which is a branch of the brachial artery. Injury to the radial nerve in the spiral groove may complicate mid-shaft fracture because it lies in close proximity to the spiral groove. Sometimes the nerve may be compressed subsequently during formation of the callus in such type of fracture.